Following your diagnosis, you are about to commence treatment with us here at the Bristol Haematology and Oncology Centre. It can be a very unsettling time filled with worry, but we hope that by watching these treatment information films, some of your concerns can be answered and this will help you feel more at ease. There are many different types of cancer and new innovations are happening all the time in order to treat them. These include surgery, radiotherapy, chemotherapy, hormone treatment, targeted therapy, immunotherapy, and sometimes a combination of these therapies. The information you are about to watch is based on your specific treatment. After watching this video, if you have any questions or concerns, please speak to your named key worker or specialist team. Chemotherapy is a drug treatment that is used to attack and destroy cancer cells. It attacks cells when they are in the process of growing and dividing. As a result, it is effective in fighting the spread of cancer. Healthy cells in our body also regularly grow and divide to make new cells to replace old ones when needed. Chemotherapy drugs are unable to distinguish between our healthy or cancer cells, and this is one of the reasons why you may experience some side effects during your treatment. The cells most likely to be affected are those that divide rapidly. These can include cells in your hair, gut and mouth, as well as blood cells and skin cells. For your chemotherapy treatment, you may be given just one chemotherapy drug or a combination of different ones, and this will depend on the type of cancer you have. Most commonly, chemotherapy is given via a drip into your vein through a needle in the back of your hand. It can also be given by tablets and sometimes as an injection just under your skin. If you are nervous about needles or giving blood samples, please speak to your key worker or your chemotherapy nurse. We will do our best to reassure you and help you through this experience. Sometimes you may need a central line. This is also known as a PICC line or a port. This will usually stay in place for the duration of your treatment or for as long as you need it. The length of time the treatment will take will depend on the drug or combination of drugs you are having. Some treatments can be given in as little as half an hour, but others may take several hours. Chemotherapy is given over repeated cycles. This means that in between treatments you are given time to rest. Treatment cycles can vary depending on your specific treatment decision. Your consultant will speak to you about the cycle of treatment you will be receiving. Everyone's treatment cycles vary, so don't worry if you feel you are experiencing things differently to others. Side effects vary from person to person and depend on the chemotherapy you are having. You will be given advice and medications to help prevent side effects, but if any do occur, you should let your clinical team know so that they can work with you to help control and manage them. You will be given a chemotherapy alert card with the telephone number for the 24-hour emergency helpline, so you can call the hospital if you feel unwell or need advice. It's a good idea to save this number in your phone or keep the card somewhere safe like your purse or wallet. On occasion, we may have to delay treatment until the side effects are resolved, but this shouldn't cause you any concern because we usually restart the treatment once symptoms are under control. We will communicate with you throughout your treatment so that you understand every step of the process. Side effects don't necessarily mean that you have to stop treatment, but the sooner you report them, the sooner we can treat them. The most important side effects to report are infection, nausea and vomiting, diarrhea or constipation, sore mouth, skin changes, or any other significant symptoms making you feel unwell. Other key ones to be aware of are fatigue, loss of appetite, hair loss, or deep vein thrombosis. We will go through these symptoms and treatments step by step. Chemotherapy can reduce the number of white blood cells that help your body fight infection. This can make you more vulnerable to infections during your treatment and could, if left unchecked, lead to serious conditions such as sepsis. It is crucial that you contact our 24-hour helpline if any of the following occur. You have a temperature above 37.5 degrees or below 36 degrees. You suddenly feel unwell, even if with a normal temperature. You develop any flu-like symptoms. You are coughing up green phlegm. You develop a toothache. You have a burning or stinging sensation when peeing, or you have any other possible signs of infection. If appropriate, antibiotics can be used to treat an infection. Some chemotherapy drugs can make you feel sick and even lead to vomiting. It is difficult to predict the effect different chemotherapy drugs will have on individual patients, as everybody responds differently. As a precaution, we will give you anti-sickness medication suitable for the type of drugs you have been prescribed. It is important to let us know if they are not effective so that we can tailor the medication to your needs. It is important that you take the medication as soon as you experience nausea, as it is more effective the earlier it is taken. If you find that you are not able to keep liquids down or that you are being sick for more than one day, call the helpline for advice. During chemotherapy treatment, you may develop diarrhea. We would like you to report if you develop loose, watery stools and have had 3 to 4 episodes more than normal in a 24-hour period, or if you have abdominal pain. It is important that this is dealt with promptly. Drinking plenty of fluids and eating a diet low in fibre can help with the symptoms of diarrhea. And if you have been prescribed anti-diarrhea medications, you can take these. Equally, it is also possible to develop constipation. In this case, you can help yourself by drinking plenty of fluids, eating a diet high in fibre, remaining active and taking laxative medications if prescribed for you. If constipation continues for more than 2 days, contact the helpline for further advice. Throughout chemotherapy treatment, you may be at higher risk of developing a sore mouth and throat, but you can help to prevent this by cleaning your teeth after each meal or at least twice a day using a soft toothbrush. If your mouth is sore, avoid mouthwashes that contain alcohol. Eat soft, moist foods, avoiding ones that irritate your mouth, such as citrus fruits or spices. Drink plenty of fluids and use lip balm to keep your lips moist. Please contact the helpline for advice if your mouth becomes very sore, dry, if you develop mouth ulcers, or if you are finding it difficult to eat or drink because of the pain. Skin changes may occur and could include rashes, irritation, blistering, pain, redness, and increased sensitivity to sunlight. When outside, it is important to put on high-factor sun cream and remember to wear a hat. Regularly applying moisturising cream can help with skin dryness, and unperfumed products are better for sensitive skin. If you do develop a rash with or without itching and pain, please call the helpline. Tiredness or fatigue is a common side effect of cancer and its treatment. For people with cancer, this lack of energy can be severe and last for a long time after treatment ends. Maintaining your normal life as much as possible during treatment is really helpful, but it's important not to push yourself too hard. Keep active and rest when you need to. Try to maintain your weight during treatment, eating little and often, and high-calorie foods can help if you have a reduced appetite. You may experience changes to the way food tastes. Commonly, people say food tastes metallic or bland. Choosing foods with a strong flavour and adding sauces or gravies to your food can help. Tart foods and citrus foods have a strong taste, although they are best avoided if you have a sore mouth. Not all chemotherapy drugs will cause hair loss. Some may just cause thinning and some not at all. We will be able to give you help and advice on wigs and hair care. Scalp cooling is a treatment used to help prevent hair loss. It is suitable for patients with some types of cancer on certain types of chemotherapy treatment. The treatment involves wearing a cold cap over the head which will cool the scalp. This helps to protect the hair follicles from the effects of the treatment. In some cases, people still experience hair thinning or loss. It is important to follow the hair care guidelines whilst undergoing scalp cooling. If you would like to know if this is suitable for you, Please talk to the nurse before you come to your appointment, as this will require additional appointment time. Cancer, as well as some cancer treatments such as chemotherapy, can increase the risk of a blood clot. Symptoms of a clot include pain, redness, or swelling in a leg or arm, breathlessness or chest pain. If you have any of these symptoms, contact the helpline straight away. You can help minimise your risk by taking short walks as often as possible, simple leg exercises, and drinking plenty of water. We understand that being told all these side effects can be worrying before you start your treatment. You are unlikely to experience all of these side effects, but it is good to be aware of them in case you need extra treatments during your cancer treatment. This is all new to you, and you are bound to have lots of questions or concerns. Please ask your nurse specialist or key worker, consultant or cancer information centre if you have any questions. Or try writing these down so that next time you come to see us we can go through them with you. You will be given an alert card with the acute assessment 24-hour phone line number on it, as well as a reminder of symptoms to look out for. Every time you come to the centre, you will pass the Cancer Information Service. Pop in and say hello. The team are very helpful and will help you get the information you need. Thank you for watching.